New at 5, a technique used by law enforcement to make neighborhoods safer is now being used to lower healthcare costs in northern Colorado. 7 News reporter Don Champion explains it all starts with figuring out who goes to the ER the most.
It is a matter of bad math.
It only amounts to about 1 or 2% of the people who are getting health care that are in that category. But because of the complexity of their needs, they are responsible for a lot more of the costs of health care.
Dr. Mark Wallace of North Colorado Health Alliance has been crunching numbers for more than a decade. He's discovered in Weld County only a few people are responsible for most of the emergency room costs.
We were able to identify 200 individuals who accounted for a tremendous amount of cost. It was responsible for about $40 million.
Weld County is combining that new accounting concept with old-fashioned health care house calls. A care coordination team visits those people in the county with higher medical needs now to try to cut down on preventable emergency room visits later.
The lady had actually had, in the 2 weeks prior to us starting, 12 emergency room visits.
Sometimes the prevention approach falls outside of common medical conditions like falls, respiratory problems, and medication allergies.
If they're worried about safety, food, all those things, they're not going to take care of their diabetes.
So far, Dr. Wallace estimates they have trimmed ER visits and costs by 20%, a small investment of attention today, leading to savings in Medicaid costs and insurance premiums in the long run.
If my care is high quality and lower cost that we can all afford, that benefits everybody. 200 people is not unreasonable for us to get to understand the challenges that they have differently than what our current system does for them.
In Denver, Don Champion, 7 News.
And Dr. Wallace's care coordination program is paid for by the state Medicaid program.